They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and on today's episode, we hope it won't put you to sleep, but we hope it'll cause you to get some better sleep. We are joined by Sarah Bush's registered sleep technologist, Rodney Wildman. Welcome to the show.
Thank you.
I guess I should say welcome back. It's been a bit since we talked sleep.
It's been a couple years, yes.
So today, as we're talking sleep, first off, how do you know if you're getting enough sleep?
The best indicator is if you feel refreshed whenever you first get up in the morning. Do you feel like you need to go back to bed? Or do you feel like, hey, I don't feel too bad, you know? Of course, you're going to take a few minutes to actually get up and get moving, but if you feel like you need to go back to bed, you're probably not getting the right amount of sleep, or not good quality sleep.
Mm-hmm. And sleep is so integral to, everything we do. Again, why do we need to have that good sleep?
The good sleep is going to help with your overall health, and it's going to help you with your memory, your learning, and just being not so grouchy, because sometimes if we don't sleep well, just like any adult, we're going to be grouchy, and nobody wants to be grouchy. So good night's sleep is really good for your health especially.
And for different age groups, are there certain amounts of sleep that we should be getting?
Oh yeah. My girls are 13 and 10, and I tell them you still need at least 9 hours of sleep every night. So yeah, they still have a bedtime. They want to stay up late, but no. And as adults, we should get about 7 to 9 hours. And then as the younger kids, you know, they tend to need more.
And so what if I'm a person who that 7 to 9, I always end up feeling kind of groggy, but I know some folks who get shorter than 7 and they say, oh, I just need a couple hours. I just need, five good hours.
Right, yeah. There's lots of people that they can function really, really well on 6 hours of sleep. And there again, if you feel like you're refreshed after maybe 6 hours of sleep, if that's what works for you, hey, that's what works for you, you know. That's just what the experts tell us, 7 to 9 hours of sleep.
So that can be an indicator that even if you're not sleeping as long, you're having a better quality sleep.
Correct. Yeah.
Gotcha.
Yep.
So again, I guess this kind of leads into that. So is all sleep the same?
No, about 75% of our sleep is what we call non-REM sleep. That's where we're not dreaming. We're either in stage 1 sleep, stage 2 sleep, or what we call our deeper sleep, which is our delta sleep. And then our REM sleep, it's about 25% of our normal sleep, and that's where we're dreaming. And that's what restores our brain and stuff like that. And the stage 3 sleep, that's what restores our body and everything. So we don't wake up with the aches and pains and stuff like that. But unfortunately, as we get older, we tend to lose that stage 3 sleep, the slower delta sleep. Mm-hmm. Like whenever your kids are little and you pick them up off the couch and they don't remember how they got to their bed, they're in that stage 3 sleep. You can just pick them, you can go in there and lift their arm up and lay it back down. They won't even know what happened.
I love watching the videos of that where the parents are just getting away with so much because those kids are out.
Oh, they are. Yes, they're repairing everything they tore up during the day in that little body of theirs.
So if you were to watch somebody as they were going to sleep, or maybe I guess what's happening on the inside in the brain, what kind of time frame does it look like as people are falling asleep? How long does it take them to go through those stages?
Okay, so it should take you anywhere between 10 and 20 minutes to actually fall asleep. And then the sleep cycles, you should go through your sleep cycle every 90 minutes. So you're going through your stage 1, stage 2, stage 3, and then you hit your REM sleep. About every 90 minutes you should be dreaming. But like I said, as we get older, we lose that delta sleep, so we tend to dream more as adults than what we did when we were younger as children.
Interesting. Yeah. And so who is most at risk for poor sleep?
Shift workers. They get, we're not made to just be up all night. Mm-hmm. We're intended to be sleeping at nighttime. So shift workers, people that travel a lot for their jobs. Jet lag is a big one. You know, stress at work, stress at home. So there's lots of different sleep stealers. Caffeine, alcohol. So there's lots of different stuff that can rob you of good quality sleep.
What about blue light exposure? I feel like that's something that's kind of been brought up more recently with everyone being in their phones or on the tablets, on the laptops, watching the TV,
right,
all the time.
And the best thing to do is shut any electronics off like an hour or so before you intend to go to sleep. So an hour before bedtime, get a book. Mm-hmm. Because that white light is what's going to keep your brain activated. And it's going to, hey, I'm still awake, I'm still awake, I'm still awake. That's why I say no electronics in the bedrooms. You know, keep the TVs out of there, phones, you know. If you're going to have an alarm clock watchers, turn it around. Mm-hmm. That way you don't see it. Yeah, you're going to use your alarm and everything. If you have your phone in there, turn it over to where it doesn't light up if you get a notification for whatever reason, you know. Because the white light is what's going to get you. But the blue light glasses and stuff like that, they help decrease it, the white light and everything, but mm-hmm. I still wouldn't try to avoid any of that light an hour or so before bedtime.
And then just to make sure I'm understanding, so then you will have a better sleep if you also turn off the TV, like once you're...
Correct.
Okay.
Yeah, because everybody says, well, I always sleep with the TV on it. Yeah. We hear that a lot in the sleep lab.
My husband's one of them.
Yes, mm-hmm. And it's not necessarily the sound, because sound can drown out the ambient noises of anything else, environmental sounds around, you know, like fire engines, police officers in their cars and stuff like that, or just mm-hmm. noises outside the home. But sound machines will drown them out. But it's the light of the changing of the scenes and stuff like that throughout the TV shows. That's what activates your brains, because you can close your eyes and you can still see light through your eyelids. Mm-hmm. So that's what activates your brain. It's like, nope, I'm not going to sleep just yet. So you won't be falling into your stages of sleep properly, because they could definitely arouse you out of your sleep.
And are there any other methods? I guess would it be kind of like the sleep mask? Are those a good route for some people to take maybe?
Oh yeah, sleep masks are really good. Yeah, earplugs. Sleep mask, earplugs. Yeah.
You just don't want to sleep through that alarm the next day. That's when you get into trouble.
Yes, you will.
And so I think you kind of hit some of the sleep stealers, but do you mind running back through those just a little bit?
Okay. Caffeine. Don't drink caffeine. I try to cut out my caffeine before lunch. I try not to have anything caffeinated after noon.
Really?
Yeah. That helps me with my sleep. Uh-huh. And nicotine. They're all stimulants. They're both stimulants. Exercise. Try to exercise earlier in the day, and definitely try not to exercise anywhere 3 hours before your bedtime. So if you're going to bed at 10, try to get your exercising in before 6 p.m.
I would almost think that's kind of counterintuitive. I would think like, oh man, if I work out, I will be tuckering myself out. So what causes you to kind of stay up after a workout? Your
heart rate will still be increased.
Okay.
And your body temperature will still be increased. So you want to keep them, because as we get our circadian rhythm, it tells us our body temperature is going to start going down somewhere probably around 9 p.m., between 9 and 11 p.m. Our body temperatures tend to go down, so that's why we start to get tired and everything.
So what about folks who nap? So I know some people, it's kind of a blessing. Other people are like, oh no, I'm not the napping type, because then I won't sleep. Do you have any sort of recommendations for that?
If you're going to take a nap, there's nothing wrong with it, but don't let it go longer than 20 minutes, 30 minutes at the very most, because once you start doing that, then you're going to start getting into the deeper stages of sleep. you start getting into a deeper stage of sleep, it's going to be harder for you to fall asleep that night. So a 20-minute nap, there's nothing wrong with that.
Now, you told us earlier it takes like 15 to 20 minutes to get to sleep.
Right.
So do I need to allot like 30 to 40 minutes so I have time to get to sleep, have that little bit of a nap, and then wake up? Or is it just 20 minutes total?
20 minutes total is all I do, because you're going to be resting. You know, you may not actually fall asleep in them 20 minutes, but 20 minutes of lying down and resting, yeah. And if you doze off, you doze off, yeah. But I wouldn't sleep more than 20 minutes. I definitely wouldn't sleep more than 20 minutes.
Don't make it an all-day affair, which I know is kind of guilty after you're wrapping up the chores on a Sunday, maybe.
Yeah, like a 2-hour nap, that's not a nap, that's a sleep, because you went through all your sleep cycle. So, yeah.
So I know a lot of people maybe kind of joke about snoring being like, oh, they're out, they were snoring. Is snoring normal? Is it a good thing, bad thing, indifferent?
Snoring is common.
Okay.
It's definitely not normal, because I haven't heard anybody yet that's awake that snores. Because our body has control of our airway, so it's nice and open. And the snoring is all them soft tissues starting to collapse, your airway starting to collapse. That's where all the vibrations come from. That's where all the racket comes from when people are snoring. So it's common, but it's not normal.
It sounds if my airways are closing. Is that a bad thing then? That doesn't sound very good.
No, it's definitely a bad thing. That's where snoring is the first sign that maybe you're having some sort of sleeping disorder that may lead to sleep apnea, because that's your airway starting to block off. So no, it's definitely not a good thing.
Can we talk about sleep apnea more? Because I feel like it's something that people talk about, and I just kind of picture like the stereotypical sitcom, and they've got the sleep mask, and that's about all I know about it.
Well, the apnea is, of course, apnea means cessation of breathing. So that's where your airway's completely blocked off. You're not moving any air. I mean, you can see the people that have sleep apnea, their chest and stomach are moving and everything, but there's no air being moved past here. It's
kind of stuck.
And then when they get that airway open, their body gets control of the airway. They make all the racket and everything, the big gasps and snorts and stuff like that. Yeah. So no, it's definitely not a good thing.
Is it something that people typically find out that they have on their own, like they've realized that they're waking up gasping, or is it typically maybe a spouse who notices their symptoms?
Right. It could be both.
Okay.
Because people wake up and they may wake up in a panic because they feel like they're short of breath. They're like, I just had something happening. They can't explain what happened, but they're waking up and they're short of breath and they're almost panting, trying to get their breath and everything. That was probably because their airway was blocked off for who knows how long, probably more than 20 seconds or so. And then they're waking up and gasping, or it could be a bed partner that noticed, hey, my husband, my wife, I can tell that they're not breathing, and then they kick and jerk, and then they wake themselves up and everything. Yeah. And that's how the physicians usually find out somebody has sleep apnea, is from the spouse.
And so after they've been, they tell their doctor that they've had this go on, what are the next steps, I guess, to start getting treatment?
Go talk to your doctor about it and let them know what is going on. Keep like a 2-week diary of what's been going on. If you suspect something is going on with your sleep, keep a 2-week diary of it and take that information into your provider and talk to them about it. That way they can make an educated decision on what actually needs to be done. And then what they will probably do is schedule you for either a in-lab study or at-home study.
And for those who maybe haven't had to have either, can you walk us through what an in-house study looks like, or one that's at home?
Sure. Okay, so if you come to stay with us at Sarah Bush overnight, all right, we're going to greet you, we're going to send you a bunch of paperwork, have it filled out and everything, and then what we will do, we'll look through the paperwork, see if we have any questions, and then the technician that works that night will put about 28 different wires on you that night to monitor your brain waves, your breathing, your eye movements, see if you're clenching your jaw or grinding your teeth. Put a snore microphone on you. We'll watch your heart rate and heart rhythm. We'll watch whether you're breathing from your chest or from your stomach. And we'll put a couple leads on each of your legs, so that way we can see if you're moving your legs at night. So it's quite involved, it really is.
Yeah.
And the home test all it consists of is a pulse ox that goes on your finger, one belt around your chest, and a cannula that goes in your nose. That way we can tell if you're breathing or snoring.
Do patients typically have a hard time, relaxing with all of that, the wires on?
They do, but it's dark
Yeah.
in the sleep lab, and it's cool and it's quiet. So you will fall asleep. I think I've had 4 people in 15 years stay awake all night.
Oh my goodness.
That's a pretty good record, though.
Yeah, that's not too shabby. And so after someone is diagnosed with sleep apnea, how do you know if they need, the type of breathing machine, or are there other actions they can take to, is it like lifestyle changes so that they don't have to wear the mask at night, or?
It could be a little bit of both.
Okay.
The biggest, probably the best thing to do is come back in, have your Cpap titration study, and we'll set your pressure at what your optimal pressure is. What keeps your airway open? What keeps you from having the respiratory events? What keeps you from snoring? That's where we will stop with the air that's being put through the Cpap mask itself. Mm-hmm. Sometimes it is just a weight issue with people, but most of the time it's what we get from our parents or makeup of them. So, the anatomy they gave us is what we got. So sometimes it's not a weight issue. It is definitely a Cpap, or you can have surgeries done to remove your uvula, tonsils, adenoids, whatever else you got in there. They can also remove any kind of fatty tissue and everything in there. Do the surgeries always work? Not always. It just depends on how much scar tissue develops back after the surgery. And for milder cases, there's oral appliances that can work. Go to a dentist that makes the oral appliances, and what they do is they lock your teeth together and pull your jaw forward just a little bit, and them work for very mild cases.
Of the sleep apnea?
Correct.
And then is it also your dentist you would need to see if you are like clenching or grinding your teeth?
Right.
Gotcha.
Yep, because they could probably give you a mouth guard to help protect your teeth and everything, so that way you don't flatten them out.
And how important is it to keep that Cpap equipment clean?
Oh, that's very important. Very important. You should wipe it down every morning after you get done with it. Wipe it down with a mild detergent and water. And they have Cpap wipes at some DME companies, and they have the other cleaning machines that sanitize your Cpap machines, your hoses, and the mask and everything, but you still need to wipe all the oils and stuff off of the mask that makes contact with your skin.
Gotta keep them clean.
Yes.
So after, I guess kind of on the flip side, instead of being asleep and your airways having issues, the flip side, not being able to get to sleep. What is insomnia?
Insomnia is just that, not being able
to get to sleep.
Yep. Or you may wake up and you may doze off pretty quick, pretty normal and everything, but you wake up for whatever reason, and you're not able to get back to sleep. You're just laying there awake, and you may doze off, then you wake up again. Then you may wake up early every day, So, insomnia is just that. It's just not being able to get a good night's sleep. And that right there would be something you would discuss with your provider, and then they can proceed with the treatment that they are more educated on than what I am, especially a sleep doctor. They can actually help you out a lot more.
And this might be a little bit out in left field, but I have to ask, if you have like a dream or it feels like you're falling and you wake up real quick, is something happening to your body in that moment? Do you know?
You mean like when you're first dozing off?
Yeah, and you kind of just, all of a sudden it's just like the bed is out from underneath you. Is there something that's happening?
That's one of my favorite words. It's called a hypnagogic jerk.
One more time.
Hypnagogic jerk.
Okay.
That's what it's called. Like when we were all in school, we'd be sitting there dozing off or whatever, and then you jerk and you're looking around, make sure nobody's seen you. That's what that is. You're just dozing off, and then you realize, oh, I gotta wake up. It's just a hypnagogic jerk.
And
it's normal.
It's normal?
Yeah.
Nothing that causes it.
Nope.
And I think there's a few other sleep conditions that are handled in your office. Narcolepsy?
Narcolepsy, yes, we test for narcolepsy. So if you suspect that you have narcolepsy, which is the ability to just, not an ability, I guess, it's just you fall asleep for whatever you're doing. It don't matter where you're at, what you're doing, you just fall right asleep, okay? So we can test for that. You will come in for an overnight study. And then the following day, you'll have a series of 5 different naps. Each of them will be 2 hours apart. And if you start dreaming in any of them naps, that's a positive sign for narcolepsy.
Interesting.
Oh, it's very interesting. It's very uncommon. We don't get a lot of patients that test for it, but we get maybe 3 or 4 a year.
3 or 4 a year. And so if I'm somebody who is diagnosed with this, what can be done? Is there anything that can be done for me?
There's lots of different, I shouldn't say lots of different treatments because I don't know lots of different treatments, but light therapy can be one of them. And I think they do that up at Northwestern University. I'm not real up on what the treatment is for it, but a lot of times it's just pharmacological stuff, the medicines that the doctors will prescribe for them.
Fair enough. And I feel like I hear a lot about RLS, the Restless Leg Syndrome. What does that kind of look like?
Right, the restless legs sometimes it gets confused with periodic limb movements. So your restless legs is what's going to keep you awake at night. So when you feel like you have this urge to move your legs when you're just relaxing in your chair or on the couch and you're sitting there watching TV and you feel like you just got to move your legs. Or if you're lying in bed and you just got to get up and walk because your legs are tingling and you just got to move them. Mm-hmm. That's what restless legs is. Now, periodic limb movements, that's whenever you're actually moving either your feet or your arms. So it's your limbs, so it's periodic limb movement. So they move while you're sleeping, which they shouldn't be doing that.
No. And I think we hit it a little bit earlier, the shift worker disorder, talking about shift workers. What's the best course of action for them, since that's, I mean, it's definitely part of their lifestyle to not be matching the regular sleep cycle?
Right. The best thing is, just like with anybody else, try to keep the same sleep time, same go to bed time, and same awake time as anybody else. Try to keep that as regularly as you can. That's going to be that's going to be the biggest benefit for you. Mm-hmm. It really is.
Because your body will kind of map out that rhythm and get into it.
It will do its best, yes.
It will do its best.
Yes.
And so if I am somebody who's having issues with sleep, do I start with my primary doctor and then move to something like your office, or?
Here at Sarah Bush, the primary physicians, they will send an order to us in the sleep lab, and we'll take care of it that way. You don't need to go to a sleep doctor. The primary care physicians will write the order, and then it goes to the insurance, and then we'll see what happens from the insurance point.
And so how long have you been where you're at?
I've been at Sarah Bush, it'll be 15 years this September.
Well, congrats. Is it all for sleep technology?
Correct, right.
So what, in your 15 years, have you noticed the technology changing, the way people are studied changing? What did you notice in those last 15 years?
They've added a few more wires over the years,
yeah.
But the biggest change are the masks, which they're really more patient. They're better for the patients now, because the old mask, they would cover your whole face and have pieces that go on your forehead. Mm-hmm. Now we have new minimal contact masks that do the same thing. So they don't go any higher than the tip of your nose, and you can breathe out through your nose or your mouth with either one. Whereas the old full face mask, they still cover your whole face. So the mask, they've come a long way, the technology with them. They're really improving a lot.
And I feel like that would help with getting more accurate results for the patients. Maybe they can sleep a little easier since not as much of their face is covered.
Right, and then they're more compliant after they leave us in the sleep lab, and then they continue with their Cpap therapy throughout the years. Yeah.
Excellent. In our last couple minutes here, is there anything else that you would like to share with the viewers at home that might be helpful to getting better sleep, or to not wait to see if you have problems with your sleep?
Now, just keep that sleep diary, and for 2 weeks, if you think you're having a sleep issue, keep that sleep diary for 2 weeks and talk to your physician about it. And if they think that you're having an issue to where we can help you out at Sarah Bush, we'll be happy to help you. And if you do have problems with your Cpap masks, as long as you've had your study done at Sarah Bush, we have a mask fitting that is no charge to you. All you gotta do is just make an appointment, and me or one of the other daytime people will help you with a different mask.
Very convenient. It's all on site.
Yes.
All right, well, if you'd like to see Rodney Wildman, you can find him at Sarah Bush. And thank you for coming on our show today.
Thank you.
And we hope you sleep well and join us for our next episode of Being Well.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.